Good afternoon, everyone, and welcome to the California Elder and Disability Justice Coordinating Council. We're here from 1 p.m. to 4 p.m. today. We want to thank everyone for joining us. And just to go through a couple of logistics while everybody is coming into the meeting room, you can join us by smartphone, tablet, or computer here on Zoom. The numbers here are displayed on the screen to join the audio by telephone number. The meeting ID is 844-6318-4036. We have live captioning that's accessible on this webinar through Zoom. So if you just toggle down to the bottom of your screen and click on the More button down there, you can choose the language of your choice. We also have American Sign Language interpretation live. I'm joined right now by Tulip, and later on we'll be meeting Byron as well, and they'll be going back and forth with us today. All of these slides, recordings, and transcripts are going to be available for you to access afterwards on the California Health and Human Services EDJCC webpage, and we also send them out in our weekly email recaps of events. We'll also have public comment available today, so time is reserved for that. And we just ask that everyone try to respect the 2 minutes that's allocated for each public comment. You can use the Q&A function to ask your question, or you can select the raise hand icon, which is also located at the bottom of your Zoom screen. I'll be able to call on you at that time and unmute your line, and you'll have to unmute yourself one more time. It's a little bit of a double process. If you're joining by phone and don't have a Zoom screen to press the Q&A, you can press *9 on your dial pad to raise your hand, and then I'll call out the last 4 digits of your phone number or your name, whichever is visible to me, and then you can make your public comment. If you have additional public comments from today, you can always email engage@aging.ca.gov. And so just to review the Council's purpose, the goal of the Elder and Disability Justice Coordinating Council is to increase coordination and develop recommendations to prevent and address the abuse, neglect, exploitation, and fraud perpetrated against older adults and adults with disabilities. And so just giving a quick overview of today's agenda, we're going to have welcome and opening remarks from CDA Director Susan DeMorris in a moment. We'll go through the Master Plan for Aging updates, go over the conservatorship work group, set aside some time for public comment, take a short break, go through the legal services work group, have another opportunity for public comment, then review the adult protective services work group, some more public comment, and then closing and next steps. So now it's my pleasure to introduce CDA Director Susan DeMorris, who's also the state co-chair, along with Eric Dowdy from the Alzheimer's Association and also the state co-chair.
Thank you very much, Megan, for opening up the meeting, and welcome to everybody today. Happy Valentine's Day. Who's wearing red on the screen? Go ahead and let us know who's with us today in the chat. We want to see who's joining. I'm very excited to resume our work today. This is our first meeting in 2023. And it's just incredible to think that this council was established just 1 year ago. And already we're gaining so much traction and building momentum on a few critically important issues, as today's agenda reflects, related to elder and disability justice. We feel very fortunate to have so many advocates and experts assembled on this council. In fact, I'm convinced that it's why we're able to make progress as a state and why we have made so much traction and gained momentum in just a year. So please know how much we appreciate your time today, everyone who's joining us, and also your time between meetings. I think that's the secret to a successful stakeholder committee or council is to be meeting in between meetings, and you have all certainly done that. So we thank you for keeping the work moving forward between meetings. I wanted to highlight two areas today before we jump into the agenda. The first area is CDA's work, the California Department of Aging, and the second would be our stakeholder work. So just a few things I wanted to share with the group while we're all assembled. First off, with respect to the Department of Aging's capacity building, we've made incredible progress this year. We are so proud that CDA has hired its first elder abuse subject matter expert, Ranjana Maharaj, who is joining us today, and Regina Wright, our public guardian liaison. Ranjana and Regina both are with us today, and you'll be working closely with them in the year ahead and get to know them through today's agenda and the work groups. Last month, we successfully launched the Office of the Patient Representative, OPR, led by Susan Rodriguez, to support unrepresented residents in 1,200 skilled nursing and intermediate care facilities in our state. In less than a month, not even 30 days, we've already received 90 referrals and performed 6 IDTs, interdisciplinary team assessments. So thank you to all of the providers and community members who have helped make this the Office of the Patient Representative known and to access the services available to you now. I want to say we have close to 400 registered in our database, and that's the first point of entry to be to access the IDTs. We also recently entered into a contract to build statewide best practices and training with Justice and Aging. Justice and Aging is the technical assistance provider to the National Center for Elder Law and Rights, and we're very excited to get that work started. We're also quite proud to be in the very early stages of a community of practice. We received a federal grant jointly with the Department of Developmental Services, the Department of Rehabilitation, and the State Council on Developmental Disabilities to align our work more closely. And that's really just in its infancy, but has a lot of potential, and we're excited to begin that. Shifting now to our stakeholder work. At the Day of Action, and I know most members of this council were in attendance, and certainly you were well represented that day, we received 3 very thoughtful and substantive recommendations from the council relative to adult protective services, public guardian, and public conservatorship programs and legal services. You were heard on September 20th by all who were in attendance, including California Health and Human Services Agency Secretary Dr. Mark Galley, representatives from the governor's office, cabinet agency officials, State Department directors, legislators, and legislative staff. In the chat, for those who have not yet thoroughly reviewed the Master Plan for Aging 2023-2024 new initiatives, there are 95, if you didn't know that. I want to call special attention to a few that reflect on this council's priorities, and I hope you see yourselves and your work reflected in these initiatives. Initiatives 66, 67, 68, and 69 related to legal services resources development, APS resources, APS training, and probate guardianship funding. So please take a look at those, and if you haven't already. And now, before we move into our agenda, I want to recognize and welcome a fantastic new addition to state service and to today's meeting. Jim Treggiari, the new administrator for APS, Adult Protective Services at the California Department of Social Services, has joined us today. Welcome, Jim. Jim will play a prominent role in discussions and decisions related to APS going forward. We're so delighted that you're here today and that you're here at the Department of Social Services, Jim. I also want to thank Eric Dowdy for serving as our council's stakeholder co-chair. Eric has certainly logged many hours in support of this group, especially during the Day of Action and preparing for that. And we're most appreciative of his leadership and insights as a representative of the Alzheimer's Association. So that concludes my opening remarks, and I now am pleased to turn the agenda over to Jackie Tompkins, our Senior Strategist for the Master Plan for Aging at the California Department of Aging.
Good afternoon, everyone. Thank you, Susan. My name is Jackie Tompkins. I am a new employee with CDA, but so grateful to be here this afternoon on behalf of the Master Plan for Aging. I'm going to walk through a few milestones that have happened this past month related to the Master Plan for Aging. First, Susan alluded to it, we did release the MPA annual report for its second year. And following my speaking session, I'll be sure to get all the links in the chat log so you all have access to these reports and resources if you have not seen them yet. But this new report does highlight the progress across all the 5 bold goals of the MPA, and it also includes some local highlights as well as legislative wins. Also, which I'll delve into a little bit more, the Master Plan for Aging did release its 2023 to 2024 priority initiatives. This continues to deliver results for older adults, people with disabilities, and caregivers. And then lastly, we're also pleased to announce that the MPA released an MPA implementation tracker. This essentially is a public-facing database to track all the MPA's progress to ensure transparency and accountability across our 5 bold goals and 23 strategies. Looking at the 2023 to 2024 MPA initiatives a little bit more, this continues to build on those 5 bold goals, and they'll be implemented through multi-sector partnerships, including the Governor's Cabinet, philanthropic organizations, universities, and the legislature. These initiatives do build on the past work of the prior 2 years, advancing person-centered, equity-focused, age and disability-friendly policy, programs, services, and research. Next, I wanted to delve a little bit deeper into the MPA implementation tracker. As I shared, this is a publicly available tracker, so users across the state and the nation can search for progress on the various initiatives of the MPA. You can search by lead agency, maybe a specific department, or a topic area. And we do want to thank our partners at the West Health Institute for their collaboration and partnership in the development of this public-facing implementation tracker. On the next slide, it shows a little bit more about what the tracker looks like. So this shows you, again, the different filter options that you can look through, again, by goal, strategy, or by agency of interest, as well as some keywords. And you can also, once you find your desired search outcome, you can also download the results. So currently on the MPA implementation tracker, we have all the updates from the 2021 to 2022 initiatives. And then as the year progresses and we're making success and progress on the new initiatives, those updates will also be publicly available for all of you as well. So I hope that you all take a moment to check that out. And also, if there are some feedback or glitches, we're very open to obtaining your feedback on how the implementation tracker is working for you. So please let us know. And then finally, I did want to share with this group that we are very excited that very shortly we are going to be releasing a request for applications for our local Aging and Disability Action Planning Grant Program. So under this grant program, we anticipate that CDA will be able to support up to 36 communities throughout the state to help those local communities develop their own age and disability friendly action plans. The plans that are developed under this grant program are really designed to strengthen the community's livability and address the current, emerging, and future needs of older adults, people with disabilities, as well as professional and family caregivers. We're looking for our local plans like the MPA to be cross-sectoral and really be about making transformational systems change. The grant program's goals also aligns with our Master Plan for Aging and our state's commitment to diversity, equity, inclusion, and accessibility. We're looking again to release this really soon, On this slide, I did provide the grant webpage, but we will also be sending out announcements once that RFA is released. And I'll put, again, the webpage in which the RFA will be released in the chat after my talk today. So I will turn it over to Sarah Steenhausen, our CDA Deputy Director for our Division of Policy, Research, and Equity, and also able to take questions if needed.
Thank you so much, Jackie. Thank you everyone for that wonderful introduction into the work of the Master Plan for Aging and for the intros as well from our council co-chairs. At this point, unless there's any questions from committee members, please raise your hand if there are any questions. Otherwise, I don't see any. So I'm going to turn it now over to focus on the work of our conservatorship work group. So pleased to introduce you all to Regina Wright, who, as Susan noted, is our new state public guardian liaison, who will start us off on this discussion. Thank you, Regina.
Hi, everyone. Sarah, thank you for that introduction. So I'd like to introduce myself. I am the new State Public Guardian Liaison for the California Department of Aging. I'm new to the role. I started the week of Thanksgiving, and I'm trying to get awareness that CDA now has this role and is taking sort of like the first real major step into being involved in conservatorship. And we're hoping to have some information about my role posted on the CDA website. So I'm just going to give you sort of like what my role is here so you can know it for yourselves and hopefully share it with others. So the State Public Guardian Liaison is responsible for providing program advice and guidance to department leadership, conducting research, and collaborating with internal and external stakeholders to help formulate strategies to improve the quality of and access to probate conservatorship statewide, with the goal of protecting vulnerable individuals from abuse, neglect, exploitation, and self-neglect. So in this capacity, I'll be doing a lot of outreach to stakeholders, including the public guardians at the county level. And so please feel free to reach out to introduce yourself, and perhaps we could meet one-on-one. My email address, while it's not posted, is just my name, regina.wright at aging.ca.gov. So please feel free to reach out. I'm looking forward to connecting with everybody. I just want to say briefly, so the focus of the conservatorship work group is going to be on AB 1663 and supported decision making. And I'm going to allow Sarah to sort of introduce our next speaker.
Great. Thank you so much, Regina. Really appreciate hearing from you. And we're so pleased to hear right now from Aaron Carruthers, who's Executive Director of the California State Council on Developmental Disabilities. And Aaron is going to walk us through a high-level overview of supported decision-making and really how it intersects with the work of this committee. So thank you, Aaron, and welcome.
Sarah, thank you so much. And thank you to Regina and to Catherine for being on the panel together. Sarah, I just want to clarify, I came prepared to talk about 1663 overall and give a high-level overview of the legislation, which includes supported decision-making in statute and also the supported decision-making technical assistance program, which happened through legislation. Your intro said I should just talk about supported decision-making. If you want me to refocus, I can.
Nope,
otherwise,
that's perfect. That's exactly what we were anticipating. You just said it better than I did, so thank you.
I'm ready to adjust, whatever the group needs.
No,
okay.
That's exactly what we need.
If I could get permission to share the screen, I have a PowerPoint that I'll share. And as that's being set up, I just want to say that I recognize and respect the great depth of experience and knowledge that many members of this council have and many members who are attending have. If my presentation, the information I'm giving is very high level, it's because it's meant to be. Touch a little bit on everything to cover it, and then we can go into details or conversation afterwards. But if there is somebody who doesn't have that same level of knowledge, then this will be really effective level setting so that we're all starting from the same place. Thanks so much for the permission. And I will begin now. Thank you. So as many know, again, very high level, two types of conservatorship, probate and Lanterman Petrus Short. So under probate, which is the focus of this work group, it's most likely for people with intellectual and developmental disabilities, dementia, or other age-related disabilities. The conservatorship can be imposed over the person or the estate. So on the person, it's about making choices about food, clothing, shelter, healthcare, or over the estate, which is about finances. The conservatorship can be complete, covering all aspects of rights and decision-making, or it could be limited to specific aspects of rights or decision-making. Our experience is that this is very difficult to end. Functionally, sometimes just described as permanent or functionally permanent. And the power gives a conservator a wide range of decisions affecting the conservatee's life. In contrast, the LPS or Lanterman Petrus Short is for people with often used for people with psychiatric disabilities, allows a person to be placed in a psychiatric facility involuntarily, and is temporary. For the focuses of the work group, we're talking about probate conservatorships. An effort to reform probate conservatorships was done by Assemblymember Mainshine with AB 1663. He introduced this in January of 2022. The legislature passed it, and the governor signed it both in September of 2022. And it's important to lay out and revisit some of the values in the legislation that were included through the findings and declarations. And that's that adults with disabilities, or older adults, are presumed competent to make decisions regarding their day-to-day health, safety, welfare, and social and financial rights, unless otherwise determined through legal proceedings. So we start off with a presumption of competence, and legal proceedings can declare otherwise. Adults, to the best of their ability and with supports they choose, should be able to be informed about and participate in management of their own responsibilities. They may use a range of voluntary supports around decisions. In moving forward with those findings, declarations, and values, the legislation organized itself, or the author of the legislation communicated about how the legislation was organized to reform probate conservatorships through deflection, diversion, dissolving, and deciding. So I'll go into each of those individually. Of the 4 probate conservatorship reforms, first is deflect. So that is to establish supported decision-making in law, to see supported decision-making as a less restrictive option, and to create the supported decision-making technical assistance program. Important note here, the technical assistance program was not created through the legislation. It was created through budget, but for purpose of conversation, I'm putting them together here. The supported decision-making technical assistance program are grants, training, and technical assistance to promote the supported decision-making practice. The next conservatorship reform is divert, and requires alternatives to be considered by courts before establishing a conservatorship, and requires assessing a person's abilities and capacities with supports. The next reform is dissolve. Provide conservatives with understandable information that describes their rights and who to contact if they wish to change or end the conservatorship. This allows the courts to terminate a conservatorship without a hearing if both the conservator and conservatee agree to the termination. The last of the 4 probate conservatorship reforms is decide. It requires conservators to consult with and make decisions aligned with the conservatee's communicated wishes. Also applies an order of preference to who would be a conservator to ensure the court first considers family members or other trusted individuals as conservators. So those are the reforms within the legislation around probate conservatorship. The other point, as Sarah mentioned, is that it puts into statute and defines what is supported decision-making. It defines supported decision-making as individualized process of supporting in accommodating an adult with a disability to enable the adult to make life decisions without impeding their self-determination. Individuals may choose to have supported decision-making agreement, which is voluntary, non-binding and written agreement, should be in plain language, which is accessible to the adult with a disability. And it could include images, be read aloud, be a video or audio recording, in addition to the written version. From the supported decision-making definition, there is a technical assistance program that is there to support expansion of supported decision-making throughout the state. This was enacted through the budget. It's $5 million one-time dollars that's divided into two sections. The first section is $3 million specified for community grants. This would include guidance, assistance, and training to educational entities, families, service providers, professionals, people with disabilities, courts, attorneys, and mediators. The technical assistance also is to provide technical assistance, or TA, on alternatives to conservatorship, and to provide trainings and supports on the use of supported decision-making, which considers tailored access, nonverbal, complex, and significant disabilities, those lacking networks or supports to help make decisions, and making considerations from people from disadvantaged communities. So that's a very ambitious list for $3 million, but at least lays out and creates a structure for what is hoped to be accomplished with this technical assistance. It also states really the need of the universe of where supported decision-making can best be implemented. It also says $2 million should be used for the establishment and operation of this program. We're the entity. The State Council on Development of Disabilities is the entity to administer the program. I can tell you we're not going to need $2 million wholly to support it, to administer it. So we're looking at ways to use that $10 million for statewide resources and the creation of best practices. So thank you so much, Sarah. That is my brief overview of the legislation, supported decision-making, and a supported decision-making technical assistance program.
Erin, that was a fantastic overview. In fact, it's one of the clearest I've seen on AB 1663, and I've already seen requests for your slides. So what I indicated is that unless there are issues otherwise, we will take all the slides and make them accessible and then put them up on our website. So thank you for that. I think it really gets us a good grounding in the work of this committee and the different issues to consider. So we have a few minutes for questions before we turn it over to Catherine Blakemore. And I see Howard, question from you.
Yes, thank you. I just wanted to say that I am extremely pleased to hear that this was finally passed and that the governor has signed it into law. This is a reform that was long overdue. And I'm very thankful to you and all of the rest of you for helping to make this a reality. This is going to change a lot of people's lives. I would like to say also that so advocate, excuse me, so advocate should also be considered. And the number of people who might want to be part of a conservatorship, and that show advocates. I think a show advocate will also be a good person to talk to, and they would certainly understand what it would be like to be under conservatorship. So I'm very pleased to hear that this has been done, that this has been passed. The more show advocate we have involved in this program, the better.
Thank you so much, Howard. Yes, go ahead, Erin.
Howard, thank you so much. We got to give some recognition and some credit to you for being a strong, fantastic advocate and helping get this legislation passed. We're grateful for Assemblywoman Mainshine's leadership, for the legislature's approval, for the governor's approval. But we also got to give credit to you too, Howard, and the many other self-advocates who came forward to say this is a priority and this is needed. Thank you.
Thank you for your kind comments. And we will continue working toward our goal.
Yes, absolutely. And that's why the work of this work group is so important and why we're thrilled to have Regina, who can coordinate and facilitate these discussions moving forward. Because as you know, this was a very high level overview and there's many different issues and angles to consider. So thank you for your comments. if there are no other questions regarding Aaron's presentation, I'm really happy to be able to invite Catherine Blakemore in her capacity as chair of the California Alzheimer's and Related Disorders Advisory Committee. This is the issue of supported decision-making is something that the advisory committee has been discussing in relation to individuals with cognitive impairment and related Alzheimer's or dementia. So Catherine's going to kind of provide some comments and thinking, and from that perspective, and of course, Catherine herself has such a tremendous background as former executive director of Disability Rights California and really understands this issue from a range of perspectives. So after Catherine's presentation, we really would love to hear from our committee members, particularly those on the conservator workshop or work group, on what your thoughts are, what are your reactions in all areas, and some considerations that you would like to highlight. So with that, I'm pleased to introduce Catherine.
Thanks so much. And it's just terrific to be here. I feel like this group represents kind of the coming together of lots of different work I've done in my life. And it's nice to sort of know many of you and see many of you. I was a legal aid lawyer for a long time, and several of you are from that. And I've done a lot of work in the intellectual and developmental disability space, and then more recently in the aging space, and really had the opportunity to work with you, many of you, on the master plan for aging and in some other capacities. So I think that leads me to, as I was thinking about this, to reflect on the intersectionality between disability and aging, which this group really brings together, and what opportunities we have to learn from each other, and how we have the opportunity to really borrow the best practices from different communities that have not always worked as closely as this opportunity presents. So I find the work that you're about to embark on very, very important and significant. I also come to this because I provide caregiving to my mom, who has dementia. And it is in that space that I think I most learned about and began to appreciate the power of supported decision-making. And I want to just take a little time to talk about that, because fundamentally, I think every human being wants the dignity to be able to make decisions and choices about their life. And we're fortunate to live in a state where, you know, those values are really enshrined in our Constitution and in our and many of our statutes. And I was able to use supported decision-making before it was really something that existed in statute, as a way to, when I was going to my mom's doctor's appointments with her or working with care staff, really help her make decisions about what she wanted. And that, I think, it causes me to think about capacity in a very different kind of way. I think often capacity has been thought of either you have capacity or you don't. And that's the sort of discussions that often happen in courts when we're thinking about conservatorships. Are you competent to make decisions, or aren't you competent to make decisions? And really what I've learned through my work as a lawyer and working with my mom is that it really is more of a range of decisions that people can make, and that our challenge, I think, is to find ways that we can support people at each stage in their life to make the kinds of decisions that they want, the choices that they want to make. And that doesn't mean that we shouldn't be aware of protections and how we ensure people aren't abused or neglected or the victims of fraud, but it means that we have to think about those things together and not think about them as one or the other. One of the things that's very significant in 1663 is sort of a range of protections and guardrails in the supported decision-making space that I think are also helpful for you to consider. So when I was thinking about just some things that I hope you will think about as you're doing your work, are things such as, like, how do we learn from each other? We have a lot in common in the aging and disability community. There is a tremendous need for education of everyone involved in supporting older adults and people with disabilities, individuals, family members, care providers, professionals. And these new concepts, I think, are important to find ways to talk about that have meaning to each of those groups. As I said, let's rethink, what does capacity mean? How do we think of capacity in a more fluid kind of way? Even for people with dementia, we can start with someone who might need some not significant help, all the way up to people who need far more significant help, or maybe a substitute decision maker. And then let's think about the range of ways that we can support people in making decisions. The new model that's new to California, but not other places, of supported decision making. Alternatives like advanced healthcare directives that honor people's choices that they've made in their life. So substitute decision makers, but ways in which those can be limited to specific kinds of decisions. And then limited conservatorships that Aaron mentioned in his presentations, and how the idea of a limited conservatorship might be expanded to older adults, so that it's not just yes or no, you need a conservator, but maybe you need a conservator to help in one area, as happens in the IDD conservatorship process, as opposed to a conservatorship for everything. So those are things that are near and dear to my heart, and I hope that as you do your work, you'll think of those, and I look forward to hearing the outcomes.
Okay, thank you so much. That's a wonderful framing for us, Catherine, particularly in thinking about, some of the considerations for how supported decision-making might apply to individuals with Alzheimer's and related dementia. And at this point, what I would love to do is put us in gallery mode. I don't think we need the slide right now. And so we want to really hear from our members of the conservatorship work group. As Catherine said, this is a very nuanced issue when you think about how you apply the concept of supported decision-making across populations. And it's such an amazing opportunity for California to be engaging in and leading in this space. So would welcome, any of your input and comments on this. So it looks like we do have a question right now. I'd like to turn it to Aaron.
Thank you, Sarah. I don't know if it's a question. I think it's more of honoring some of the discussion that happened within the work group. As Catherine Blakemore mentioned, part of this conversation is looking at the intersection of aging and disability, or aging and developmental disability. But I also want to honor the conversation that happened within the work group that was about the distinctions between aging and disability as it relates to conservatorship, the need for them, the continuum of experience that Catherine talked about, and also how supported decision-making could work differently or be needed differently depending upon aging or disability. So in my presentation, I didn't want to imply glossing over a really important, helpful conversation. So raising that first. Thank you.
Definitely really important. And we would love to hear from those members of the work group and the different perspectives. And I'm pleased to see that we're here joined by Janie Whiteford. And Janie, you have a comment or a question?
Thanks very much, Sarah. Janie Whiteford with SECA California In-Home Support Services Consumer Alliance. And looking at IHSS, I am just thrilled to hear this, because we are looking at, with IHSS, so many seniors and persons with disabilities coming in that we have not seen before, particularly with dementia and Alzheimer's. And knowing that, what are we going to do when we have providers who don't understand this process? We want these folks to be able to stay at home. We want them to be able to lead the lives that they want to live. But this concept of supported decision-making needs to be pressed out there with our social workers, with the department. It really needs to be looked at from family members. We know so many of our folks have as their providers, family members. And this is a concept which is new to so many people. The education pieces, as was already mentioned, I think is huge. And I'm just thrilled to see this. Thank you.
Thank you so much, Janie, particularly with your perspective as in the IHSS program. It's really helpful to hear that angle. And so we have Howard and then Lisa Nuremberg. So Howard.
Okay, thank you. And I just wanted to say that I think there's a great progress and we also need more education to make people realize that just because a person might not be competent in one area doesn't necessarily mean that they are incompetent in all areas. You know, people have their strengths and weaknesses, and we should try to increase their strength and decrease their weaknesses, try to keep them in a least restricted environment. And we also need to advocate for more research into the medical causes of Alzheimer's and dementia. We may not be able to cure these things, but surely we can come up with better drugs that will enable people to regain at least part of their capabilities and make them better able to make decisions for themselves. I think that needs to be done too.
Yeah, thank you, Howard. Yeah, certainly illuminates the importance of doubling down on all of our efforts to try and find a cure for Alzheimer's. That would be incredible, and the pharmaceutical interventions. But until we hit that space, I think this could be a tool too to, as you said, you know, think about how we might approach the needs of this population, and recognizing there's a variety of perspectives on that and important considerations that we'd like to hear from the committee on. And I'm really pleased that we've been joined by Lisa Nuremberg. And Lisa, if you could introduce yourself and go ahead, and we welcome your comments on this.
Sure. Hi there. I'm Lisa Nuremberg. I'm the Executive Director of the California Elder Justice Coalition. And I want to echo Erin's comments about the richness of the discussion that we had in the conservatorship work group. I think it was a really great discussion. And one of the things I really appreciated that I haven't seen very often is a discussion about some of the differences between disability rights community and the aging community. And the area of conservatorship is one where I think some of those differences really become very significant. And, you know, as we talk about, supported decision-making, I think that's an ideal that a lot of us, certainly aspire to having more of. But the reality is that we know very little about it in the arena of older adults. The kinds of decisions that people are asked that need to be made when somebody is 90 and is starting to have problems and has an estate and family members fighting over it, and those kinds of things can be much more complicated, I think, than we think of in traditional supported decision making. I think that's something that really needs to be talked about. Also, while less restrictive alternatives is also something that is kind of a mantra in our field, that's something we look at. We don't have a lot in people talk about having advanced directives as being an alternative. Well, it's an advanced directive if you had one earlier when before you become incapacitated. But there are a lot of problems with the kinds of issues that people on the ground are dealing with on a day-to-day basis, where somebody is having their assets drained, their bank accounts drained, or they're left in the hospital because nobody has decision-making authority to admit them into a facility. And we don't have these short-term kinds of interventions. So as we talk about reforming conservatorship, a big part of it really needs to be making sure that we have those alternatives. We also talk about limited and temporary conservatorship, but they're not really limited and temporary in the sense that they're often needed. They're very limited in their limited scope. So I just wanted to put those out there.
Really important perspectives that you're offering, Lisa. Thank you so much. And how great to have James Trighieri here, who also has a background as a legal aid provider himself. So Jim, welcome in your new role as statewide APS administrator, and would welcome your comments on this issue as well.
Yeah, thank you so much. This is just such a really exciting space to be in, and such a wonderful opportunity for us to be thinking about ways to do this better. I mean, I just echo a lot of the thoughts of previous speakers. And I'd like to just point out, I'll be speaking later because I'm the chair of the APS subcommittee, but I am attending all three work groups: legal services, conservatorship, and APS. And I think that's really in recognition of the interconnected nature of what we're talking about. During this conversation, I'm hearing and thinking about the many ideas and many ways that APS workers could play critical roles in supporting alternatives, supporting this, different types of support, avoiding conservatorships. I know from my previous role in being directly part of legal aid, how important a role legal services plays in all of this. And so just to know there's several of us, I would note to those listening that are on a lot of 2, 3 of these committees, and really understanding and recognizing that having this conversation not be separate, but happening all in the same space is, I really think, an incredible opportunity moving forward.
Yeah, couldn't agree more. I think just the interconnectedness of the issues across the work group and really across the system, even beyond this committee, right? And I think that these full committee meetings provide a great time to kind of bring together the issues that are discussed in the subcommittees and figure out where the alignments are and where the broader system issues are. So we're just really pleased to have you engaged in this conversation with the range of perspectives you bring on it. Comments from other committee members or thoughts, or as well as, if any of our staff would like to comment. Oh, good. Carla, welcome.
I'm sorry, I'm as many of us probably multitasking and trying to address patient issues while being here, but trying to stay present. So I've said this before in some of our subgroups, but I'm really excited to think about when we can avoid conservatorships. And I've also, in my own experience as a geriatrician and working people with advanced memory loss and neurocognitive disorders, once APS is involved, sometimes in their severe forms of different parts of neglect, I really worry about our over-reliance on self-determination and forgetting and not understanding how neurocognitive deficits affect decision-making and understanding the risks and benefits. As I often tell some of my patients and their families, we're adults, we're allowed to make bad decisions as long as we understand the implication of those decisions. So it's a really slippery slope. And I'm just worried about, how to frame the discussion, how to educate our APS workers, which UCSF has been involved with in terms of understanding neurocognitive disorders and how they affect decision-making capacity and where conservatorships are needed.
Really important consideration. And Carla, would you mind, I know that if you could kind of give the background on what your professional capacity is just for the group.
Sure. So
such an important perspective.
I'm a professor of medicine at UCSF. I'm a geriatrician and palliative medicine physician, so I've worked in home-based care for over a decade, currently also work in hospice. And so unfortunately have seen large spectrums of different types of abuse over my career, large spectrums of cognitive disorders from early onset to very advanced. And so I've seen the full gamut. I'm also a researcher on the effects of loneliness and isolation in older adults, and there's clearly some overlap there with abuse and neglect and many different things, and what happens when people are unbefriended adults and don't have other family members or friends as advocates.
Thank you so much. Wow, you have a lot of experience that's applicable to much of what we're working on right now. So we're so glad to have you as part of this conversation. And something that strikes me along what Catherine and Aaron and others have been saying is we all recognize the greater goal, which is, of course, enabling people to have the greatest ability to make their own decisions and self-determination, and recognizing that of the whole broader community, not everybody is the same, and there can be very much nuances in how we approach it. So I think as we really dive into these issues in this work group, these are such important considerations. And what would be ideal is if there's a way to get to yes, but also provide the safeguards so that we are ensuring that those who are subject to potential abuse have their rights, have their needs protected. Of course, that's so critical. So Blanca, wonderful to have you here.
Thank you. So I just wanted to pose this question, in that as we use the word conservatorship, and I'm really speaking from the perspective of somebody who is Hispanic and trying to explain this in Spanish, it's actually a completely different word, is tutela, which is comes from the word tutelage. So what kind of care or guardian do you give? So it's more of a guardianship. But I was wondering if there was discussion around explaining conservatorship in a way that you could clearly delineate what is the difference between power of attorney and conservatorship, because when we're working with residents in the long-term care facilities, and they do have, different levels of cognitive understanding, and sometimes even just different levels during one day. This is a really good opportunity to use, for ombudsman to use, to even just give them some language and terms to use, if you will. So I didn't know if there was any discussion around that, because of the group that we have, people understand it, but the broader public.
Thank you so much, Blanca. And just so, and for those of you who don't know, Blanca Castro is our state long-term care ombudsman. And of course, the ombudsman plays such a critical role in working with and advocating, or I know that's not the correct word, supporting the rights of residents of our long-term care facilities. So Blanca, thank you for raising that question. And I see that Catherine has her hand raised, and then Vivian as well. So Catherine and Vivian, if you have responses to Blanca's excellent point about power of attorney versus conservatorship and communicating it.
I have a somewhat broader and connected point to what Blanca said, which is, I think these all have to be described as a range of different choices, with some working at some points in someone's life and some not working at other points. So I sort of talk about, like, what does independent decision-making mean? What does supported decision-making mean? Supported decision-making is someone helping you make a decision. They're not making a decision for you, right? What are the different forms of, sort of alternatives or the substitute decision-making, which would be power of attorney, durable health care. You can do an authorized representative, which gives somebody else the power to, sort of in between those things, right? But I feel like the discussion can't just focus on what is a conservatorship, as Blanca was saying, but what are the other things that you should have in place, or what are the other things that should be discussed at the same time, so that we're sort of doing the right support to make a decision and keep someone safe, depending on where they are in their life. So kind of having that almost like a toolbox that you could use to explain to people, here's what this is, here's what that is. Let's talk about all of these different choices.
Wonderful idea, especially given the opportunity that, as the State Council on Developmental Disabilities is building out their work and thinking of the different toolboxes that can be, kind of individualized towards different populations. So thank you for that, Catherine. And Vivian, welcome.
Hi, so I completely agree that I think we do need more specific definitions. I think that generally we tend to, at least in the aging community, we tend to talk about things without necessarily being very specific about the types of conservatorships that we're talking about, or the types of tools that we're talking about. And that can be really confusing to lay people who are trying to understand what's possible for their family member or themselves. So I think it's really important that we always make sure we're very precise with our language when we're talking about conservatorships specifically, but also other forms of tools for supported decision making. But I also think that it's really important that we make sure that when people are talking to people about these types of things, we distinguish what are actual legal tools and what are not, because you tiptoe into the realm of giving people legal advice, or the situation where someone really does need legal advice. Like they actually really need to talk to an attorney about what is the best tool for their situation. And, you know, we'll talk about in a little bit later about legal services, but I think that in educating people about the different things that are the different options that are available, it's important to make sure people are connected and understand that an attorney also has a specific position in providing advice and understanding of these concepts, because they are legal concepts. Like conservatorships do not pop up at your local grocery store. Like you have to go to court for this. This is a legal proceeding and a process, and there's specific rules. And so making sure that people have access to legal services so that they can understand what this means for them legally is really important. And getting that advice so that they can make a really good decision about what they want to do and the legal implications for it, not just for them, but also for third parties, because a lot of this impacts the ability to communicate with banks, with health insurance, things like that. You know, so you can't just make that decision in a silo.
Wonderful points. And just this importance of the language that we used and how this is all communicated, and for whoever the target audience is, understanding the difference between information and materials versus the legal realm, and when you actually engage in the more specific discussions that impact conservatorship. And I think also another comment that's been raised in chat is about when we talk about using precise language, also being really mindful of linguistic and cultural relevance, so that for different audiences, there might be different ways to communicate this. And I know that Vivian, as your in your role as Director of Equity and Elder Justice at Justice and Aging, this is certainly probably something that you have confronted as well. So it's we're going to need to just be paying close attention to that as this work rolls out. Okay, well, we have a few more minutes if there's other questions or comments. I think this has been a very rich discussion. It's so nuanced and so critical in advancing kind of the charge of this committee. So I think you all definitely have your work cut out for you, that's for sure. But certainly appreciate the range of important comments and considerations given to this topic. Regina, do you have any other thoughts that you want to pass along before we close out this session?
I'd just like to take the opportunity to thank again Aaron Carruthers for his wonderful presentation, and Catherine Blakemore for her really insightful just commentary about how this has the potential, like what is the realm of possibility about applying supported decision making to older adults as we sort of navigate, you know, the similarities and differences of where people with developmental disabilities and older adults, like what are the commonalities, but also respecting the differences. So just really want to thank both of our presenters, and I know I got a lot out of it. I'm sure everyone else here did as well. So thank you.
Absolutely. Ditto to that. And thank you so much, Aaron and Catherine, as well as all of our members of the committee who are weighing in. And really, this is why I love these work groups and these committee meetings, because we're here to learn from all of you. You all are the experts, and you help inform our thinking as we're seeking to address these issues at the state level. So thank you so much for that. Okay, so with that, at this point, we are going to open it up to public comment, and I want to turn it over to Megan of our CDA team to help us with that.
All right, everybody. I do see one person with their hand raised right now. So while people are deciding whether they want to make a public comment, just reminding you it's 2 minutes for public comment. You can use the Q&A function at the bottom of your Zoom screen, or if you're on the phone, simply press *9 on your dial pad to raise your hand and we'll be able to see you. So I will move over to the call list right now and go in order of hands raised. I see Judy Mark with Disability Voices United, she, her. Judy, I'm gonna unmute your line and then you can unmute as well and make your comment.
Thank you so much. Can you hear me okay?
Yes.
Great. Thank you. I'm Judy Mark. I'm president of Disability Voices United, which is one of the organizations that worked with the state council to get AB 1663 passed. And I appreciate having an opportunity to comment. I'm also the parent of a 26-year-old son with autism who requires a maximum amount of support every day and who is not conserved. I'm also the daughter of a woman who died at the age of 93 with Alzheimer's, who really required supports on every single possible minute of her life, and also was not conserved. And so for me, it is really important that this committee understand that it's not, there's not even an area that I believe we need to be considering conservatorship. And I know I may be a radical person in this, but I do not even see that as that there shouldn't be like a choice of you can do conservatorship or you can do powers of attorney. Conservatorship is is so extreme. It takes away the civil rights of people, that they have less rights than prisoners. And I have to comment on what was said, that there's an over-reliance on self-determination for some people. I've actually never heard that phrase being used, because for me, people without disabilities make bad decisions every single day without understanding the consequences of what they're doing. And so I don't know why people with disabilities need to be held to a different standard. And the other thing I just wanted to say is that just because you can serve somebody, it doesn't mean that they're protected against abuse or neglect. In fact, studies have shown that in the IDD community, people who are conserved have much higher levels of abuse and neglect, and that self-determination is the way to keep people from that abuse and neglect. And so we really have to figure out how to disrupt this idea, this mainstream view that the only way to protect somebody is to take away all of their rights. And so I hope, I'm happy to work with you all on these recommendations coming out of this committee, and really thank you for your time.
Thank you so much for your public comment, Judy. I don't see any other hands raised at this time, Sarah.
Okay, well, thank you. And yes, thank you for your public comment as well. We always appreciate hearing from those of you in the audience. So at this point, unless there's other questions, we can move to a 10-minute break. And what's super exciting is we are ahead of time. So because of that, that means we have flexibility in the schedule. So if other agenda items run a little over, that's okay. We'll just keep it moving. So at this point, it's 2:02. Let's aim to come back by, we'll say 2:12-ish. If you could be back, we'll get started between 2:12 and 2:15. So thank you all.
I need to go to the bathroom. Huh? Number 1? Yeah, number 2. I take it Jessica is not here yet.
Okay, we will get started in about 1 minute. All right, well, welcome back to our committee members and to those who are listening in. We're really, really pleased right now to begin our discussion of the legal services work group at this point. So thank you so much for being here. And I first want to introduce Ranjana Maharaj, who, as you know, is our Elder Justice Specialist at the Department of Aging. And she is leading the work of the Legal Services Work Group. So Ranjana, take it over from there, and then we'll open it up for discussion.
Perfect. Thank you, Sarah. Hi, my name is Ranjana Maharaj, and I'm the Elder Justice Specialist, which is a new role at CDA. My role focuses on elder justice initiatives, and as a subject matter expert, I'll be working with many of you on initiatives that address elder abuse, neglect, and exploitation of older adults and individuals with disabilities. I will be facilitating 2 work groups out of the 3. One is legal services, and the next is APS. I'll be working with state, federal, local government agencies, as well as stakeholder advocates in leading the coordination efforts. I'll be supporting work group discussions, tracking our progress and recommendations effectively throughout the year as we move forward in aligning our goals with the Master Plan of Aging and for California for All. So I'm really humbled to be here.
Thank you so much, Ranjana. We're so happy to have you here as well. And now it's my pleasure to introduce you to our first speaker, who has been very engaged in our Elder and Disability Justice Coordinating Council, Vivian Mbaku, who's Director of Equity and Elder Justice at Justice and Aging. Vivian and Sil Vossler, who is an attorney with the Vossler Law Group. Together, they will provide a presentation with a legal services lens, including on background on the legal services work group, key issues, and next steps. So with that, I'm happy to turn it over to Vivian and Sil. Thank you.
Thanks. Can you hear me? Okay. So today we are just going to do, a brief presentation and have questions at the end, but we really want to open up a discussion with the information that we have. Next slide. So to start this discussion in viewing elder justice through the lens of legal services, we wanted to just go over quickly what are legal services, what are AAAs, so that we have everyone has kind of a basic understanding of the entities that we're talking about. So generally, low-income Californians, and this is, this can be applied nationally, low-income individuals can receive free legal assistance from legal aid organizations that are around the country. And so here in California, low-income Californians can receive free legal assistance from legal aid organizations, but older adults and adults with disabilities can receive legal assistance through their local civil legal aid organizations and their local area agency on aging. And a civil legal aid organization is an organization, nonprofit organization of attorneys, paralegals, other support staff that can help older adults who have experienced abuse by assisting with obtaining protective orders, revoking misused powers of attorney, obtaining stolen funds, etc. But they're also able to assist people outside of the issue just of elder abuse. They can also help with other civil legal issues like housing issues like foreclosure or eviction, public benefits issues like Medicaid, Medicare, SSI, SSDI eligibility and appeals, and consumer issues like debt collection. But it's always important to remember that these programs are funded by a variety of sources, but many who are providing services to victims of elder abuse are receiving Title 3B funding, and that's 3B from the Older Americans Act, and or some funding from Legal Services Corporation, which is a federal agency, or IOLTA funding from the state bar, and private funding from just private organizations, charitable organizations that support the work that they're doing. Next slide. So an area agency on aging is an agency designated by the state to address the needs and concerns of older adults at regional and local levels. These are available in every state in the country. So their geographic coverage can really range, but many AAAs are responsible for contracting with legal aid organizations to provide legal assistance under their Title IIIB funding. So they might contract with an existing legal aid organization to provide that legal help for older adults, or they might contract with, for example, like a solo practitioner attorney in a rural area. But any person over 60 years of age, regardless of income, can get these services. And the services that they can get really ranges, but generally civil legal aid stuff. So a lot of the stuff that I was talking about, so debt and consumer rights issues like identity theft, scams, debt collection, general estate planning, healthcare, pension and retirement issues. But it's always good to remember that, the funding that legal aid receives is limited. So there's always going to be more people in need of help than there is available funding in attorneys and paralegals and support staff to provide it. And that's something that California faces as an issue, but that's a nationwide issue. There's always more low-income people who really need assistance than there is attorneys that are available to provide that assistance. Next slide. So I always like to make sure that people have some information. If you, think, oh wait, but how do I know who provides legal aid in my area? Where's my AAA? How do they get legal services to older adults in my area? You can find all of that information at the Elder Care Locator, which is administered by the Administration for Community Living, a federal agency. So it's eldercare.acl.gov. And they also have a phone number that's there, and that you can just put in your zip code and it will come up with all of the resources for older adults that are available in your area. And that will include legal services as well. Next slide.
Okay, so I'm going to jump in. I don't know if I can see myself, but I'm just going to go for it. So some of the challenges that are faced by clients when obtaining legal services. The first is geographical limitations. I can't really explain how many times I've seen this issue pop up, particularly for seniors who need legal services. For example, recently I saw a couple seniors I think they were in Turlock, who were being evicted and they were unable to find legal help. And a friend of mine actually had to help them pro bono from San Francisco, even though he's, a private lawyer. The situation is much more dire for seniors who are facing financial elder abuse. Recently, I saw a case where seniors were up in Butte County and they had $14,000 stolen from them by an insurance company. And they had to go down to San Francisco to find an attorney who would be willing to write a letter for them. And they had to go down to San Diego in order to find a lawyer who would be willing to represent them in the case. It is extraordinarily difficult for seniors to find local help, particularly those seniors in rural areas. Language barriers are often an issue. When I was a legal services attorney in San Francisco, I can't tell you how many times I had clients coming in speaking Tagalog or other languages that I don't speak, and obtaining translators was an issue. Client access, whether it's physical access, you have clients with mobility issues, clients with cognitive impairments, which make access to legal services difficult. Knowledge of legal issues. This comes up, particularly, this was mentioned in the estate planning context, where you have clients who don't really know the difference between power of attorney and advance directive, and why they would need something like a will or a trust, which, I'll talk about a little bit later. It is often really important for seniors to keep their wealth in their family and keep their family from being displaced from the community. Then you have challenges facing legal aid organizations. And this is also a challenge. These are interrelated with the challenges faced by clients. You have limitations on areas of law. Some legal aid organizations only do evictions. Some only do employment stuff. Some only do restraining orders or conservatorships, and then finding the right organization that's going to help a senior. They could have to go to 3 or 4 or 5 different organizations. They might get rejected. People are getting rejected and told to go to another organization. Referral networks are insufficient. That you have staffing and funding issues, geographical limitations. Again, you have certain legal aid organizations which only help people in specific areas. Outreach can be an issue. Subject matter can be an issue. How do you work with somebody who has cognitive impairments? And then this one down at the bottom is really important, that there are inadequate referral networks for getting cases in the hands of the right people, particularly when it comes to private bar referrals, because not every case is suitable for legal aid intervention. If you have a financially abused senior who had, the cases that I handle, for example, I do predatory lending, wrongful foreclosure, and large commercial fraud cases, which if you have a legal services group, it's too many, it's too big a case, it's too many resources. Those cases need to be handed over to private attorneys, but state bar lawyer referral networks are inadequate. Very few elder law panels exist for cases like that. APS and the police and the district attorney rarely make referrals to civil attorneys. Financially abused seniors rarely know that they need to go to a civil attorney, and so you have a large gap where people are falling through the crack and not getting the help they need. One of the clients that I have right now had $1.2 million stolen from them. And he went 2 years having gone to the police and APS and the FBI, and nobody ever told him that he needed to contact a civil lawyer. And so he had lost his life savings, but he's languishing in poverty, not knowing that there's somebody who can help him. And the civil lawyer is the person who could do that. And so I think one of the things we really need to do as a state is build up those referral networks and make sure that seniors who are reaching out for help are being referred to the people who can help them. Next slide. So services that are needed for older adults. Comprehensive estate planning is this is so important. And there was a public comment earlier about how conservatorship is an extreme thing, and they weren't wrong. For so many of those cases, had the senior, when they had capacity, gone to an attorney and gotten a power of attorney done, could have cost a couple $100, or if they got in the hands of a legal aid organization, it could have been free. They would have somebody in place who could handle their finances, or whether it's an advanced directive and medical decision making, have those in place, and then avoid the entire conservatorship process, which could cost tens or hundreds of thousands of dollars of state resources. You also have situations where seniors don't know that they need revocable living trusts. This is particularly important in low-income areas like San Francisco. I worked in Bayview, where you had low-income people who had high-value homes, and if they don't have a revocable living trust and they pass away, their estate needs to go through the probate system, and that could cost tens of thousands of dollars. And in order to pay those probate fees, the heirs need to sell the property, pay the probate fee, and now they're forced out of the community. And so you have wealth being taken out of the hands of low-income families. And those families are being displaced from the community because these families don't have access to estate planning. And then you also have the increased likelihood of conservatorship for those families where they don't have power of attorney or advanced directives in place. There are also the need for restraining orders for physical abuse, housing help for eviction and foreclosure, financial abuse litigation, which is frequently in the purview of the private lawyer. And you also have probate, conservatorship, and alternatives to conservatorship. All right, next slide.
Thanks, Sil. So the support needed for legal services attorneys, I think funding, number one, really ties into a lot of the things that Sil was talking about. So funding limitations for legal aid organizations, which are nonprofit organizations, really dictates the type of work that is done. So when there is funding for housing and housing protection, like there has been recently, people do that work because there's money there to support the work and hire attorneys. But there's not really that funding for other areas of law where older adults have more of a focus, like estate planning and alternatives to conservatorship, et cetera. So providing funding for the areas of law where we see gaps is going to be really important because organizations can't otherwise do that work. Also trainings to develop the legal skills of legal services attorneys. In addition, people avoid areas of law where they're not competent because it is an ethical violation for them to practice law in an area that they are not competent and cannot provide competent services. So we need, building up the expertise of people in areas of law that impact older adults. And also, this connects to this last point, working with diminished capacity clients, working with people who have cognitive issues. That's a skill. There are things that, there are tools and resources for attorneys to work with those clients. But clients can be, attorneys can be fearful of working with them because they don't know, like, what is the capacity of my client? How do I even assess the capacity of my client? How do I assess, what I can do with them? But there are tools for attorneys, and helping those attorneys develop those skills is going to increase the amount of people that are available to assist those older adults. And then finally, restorative justice and alternatives to litigation. We've talked a lot about today, just alternatives to a lot of things, a lot of legal constructions that we have. But the idea of restorative justice and the alternative to litigation within the elder justice and elder abuse realm is really new, but also very important. It's been applied for many years in the juvenile system, and within the elder justice arena, people are looking at it, but we don't have a lot of training. There's not a lot of support for people who are interested in implementing these types of programs. So really putting in resources and funding for attorneys so that they can provide those services to their clients is really important. Next slide.
Yeah, before I go into this, I just want to piggyback off what Vivian was just saying to talk about the alternatives to litigation and how important that is, because particularly when you have seniors who are cognitively impaired, who may be abused by the only person in their life, whether it's a caretaker or something like that. If you file litigation against a caretaker, you might end up causing a decrease in the quality of services that the senior is receiving. And so having effective alternatives is really important, and training attorneys on when to seek alternatives is really important. So I'll move on. This, the California Elder Justice Coalition put together a cross-disciplinary blueprint, which highlights a lot of the areas that are really relevant for elder abuse prevention, talking about particularly legal services interventions. And it really goes into a great detail about a lot of the issues we've talked about today. And I would encourage you all to go and look at that at the link provided. I think that's the same slide. Yeah.
Okay, wonderful. Wow. Again, another terrific system overview, really looking at breaking down the whole legal services system, serving older adults and with people with disabilities, challenges faced by the clients, challenges faced by the organizations, and challenges faced by the attorneys. And, I just noted many similar challenges, right? Funding, access in terms of geography, in terms of language, staffing issues, the need for technical assistance in terms of how you might working with populations of people with cognitive impairments and how to do so effectively, and just the need for support for the whole network. So this is all such an important discussion and overview. And I do want to note that we're really pleased the CDA, Department of Aging, is working with, we reached out to the National Center on Elder Law and Rights, which is staffed by the Justice and Aging. And they have a grant to really do a deep dive and look into California's legal services system, and particularly where the areas of needs are in supporting access to legal services for older adults and people with disabilities. So they're just beginning their work. Some people on Vivian's team at Justice and Aging, and I know that they will be reaching out to this committee as well for input and feedback to figure out how they might use the resources in this next year to address some of the issues, provide technical assistance, and really understand where the challenges are. So we're really looking forward to that. And now I'm so pleased that we have James raising his hand. Would love to call on you for your perspective on all of this, Jim.
Yeah, great presentation, Sil and Vivian. And I think I really want to lift up, which I think, Vivian really highlighted is that, I think we have a lot of work to do in terms of public awareness of legal interventions. I think there's a lot of studies that, the public either greatly remains unaware of or underutilizes, potential legal interventions. And especially when we talk about legal remedies, timing is a really important factor. And so, moving things upstream, so we're getting to problems earlier or before they're problems, really can increase the effectiveness of legal interventions overall. And so I think I really want to lift up kind of that public messaging, that public kind of effort we need to be making to make sure that folks understand the availability of legal services, understand when it's appropriate, and are better utilizing it as a resource to help them.
Great, wonderful point. We need an easier way for people to access information on what supports are available, not only in the LTSS system, but in the elder justice and disability justice system as well. And it ideally would be part of all the same network. So thank you for that. I would love to hear from others who are on the work group as well. Any other comments or thoughts? Please, raise your hand from others. Scott Perello, I know you were on the work group and might have some comments as well, or Sil as well, and as well as Vivian, if there's anything else that you want to add into, just to kind of build off your comments in terms of how you think this work group really can focus its efforts on these issues, given the range of challenges facing the system.
I can add in, to preface, I'm a former legal services attorney. That's how I started my legal career. And I know, from my experience and the experience of all the people that I've worked with, legal services attorneys are more than just attorneys. They serve as attorneys, counselors, a lot of times social workers, doing all types of things outside of the realm of legal work to support their clients and to improve the lives of their clients. And I think that if we can create better connections between these other agencies and groups who advocate for older adults, like better understanding and connections with APS and other organizations, it can kind of lift some of that burden, because I feel like a lot of legal services attorneys, they know how to use the law to advocate for their clients and make their clients' lives better, but they often feel very lost when in terms of other organizations that can help their clients. They feel like, they call someone and they say, I can't tell you anything, or they don't have any resources. And so because they are, in essence, very, focused on zealously advocating for their clients, they figure out another way. And while that's great, they could help more people if they weren't doing all these other things in addition to being someone's lawyer. So I think that there's really an opportunity to create understanding around the older adult community of who does what and who does it the best, so that people can hand off tasks confidently without thinking I have to do everything.
Great.
Yeah, if I can
go ahead, Sil.
Yeah, no, I think that's so important. I was also a legal services attorney, and when I would have clients come in, they'd have a legal issue, but these issues are all frequently so interrelated, and you'd have a client who needed They're being financially abused, they're being physically abused, they're also self-neglecting, they're also, they may need housing, they may need social services, and so it's so important to build robust connections between organizations, not just for referrals, for making sure the clients are getting the services they need.
Absolutely. And this just underscores the importance of having a much more interconnected system across all of our different networks of healthcare, human services, social services, LTSS, legal services. People don't live in silos, so their problems are all interconnected. And this really does relate to a key goal that we're working on with the Master Plan for Aging, to try and produce develop a broader statewide no wrong door system, where this falls within that. How can people access what they need in a much more streamlined fashion, so that legal services providers can actually focus on being legal services providers and do warm handoffs to folks in other parts of the network that can assist with other areas of support that's needed. So really helpful hearing your comments on that. And so Lisa has her hand raised, and then Claire Ramsey. Lisa, welcome.
Well, I just thought I would drive this intercoordination point to the ground a little bit more. I think it's so important that we have, opportunities to bridge some of these gaps. And clearly, in the last session talking about conservatorship, the question was raised, why do we need conservatorship? And I think, Sil and Vivian have really pointed out, the kinds of cases that, this kinds of situations that could have been prevented really require active, robust outreach to legal services. And I think that point is just so important, that if we want to avoid these more restrictive alternatives, that we really need to have, get the word out to the public that estate planning and advanced directives are not just things that wealthy people need, that, to keep wealth in our communities, we need to have people planning in advance. So just want to, I also have to correct Sil, thanks for plugging the blueprint, but it's not up yet. Our new version will be up later this week. So, and you'll have, and there's a lot more. Well, yeah. And there's a lot more wisdom in the blueprint from many of the brilliant people on this call, Sil and Vivian and Jim and others. So
great. Wonderful. Well, that's a tremendous resource for us all to have. We look forward to it being released. And I'm so pleased that we've been joined, Claire Ramsey, Chief Deputy Director of Department of Social Services, who has been here and listening in. And Claire, welcome.
Thanks, Sarah. And I feel like I'm part of a group now where I'll say former legal services attorney as well. And I just want to sort of highlight the importance that I think Vivian and Sil were really pulling out of sort of the uniqueness of providing legal services to older adults. Like, one of the real strengths we have in our system is that you can help older adults without reference to income limits, because of the way that the federal funding works, which is really great, right? It means you can help a lot more people, but it also means that the issues they may be bringing, to the points that were made before, might be more financially complex than what a legal services attorney would normally deal with. And so, just whether it's around home ownership or sort of people using complicated financial instruments to defraud or to take advantage of people, it just sometimes gets beyond the bounds of, if people are much more used to working within the public benefits system, and then you have sort of this whole new system that's sort of laid on top of it. So I just want to say that I think I hear all the thinking that's already going on, but just where within our private attorney space is there more thinking about what resources could be available for older adults, just thinking successfully partnering with pro bono attorneys. How do we get more interest from the private bar in taking financial abuse cases and things like that? I'm sure many of you are thinking about that a lot. It's just one of those areas where I think I think about a case I had where there was the intersection of somebody basically misusing a power of attorney to try to basically take away somebody's house, like to basically like remortgage their house and things, like do all sorts of shady things, but really needing a private firm to be able to bring the resources to bear to really deal with the case. And I don't know that the case ultimately was that complicated legally, but it was not within the scope of legal services. So I just think it feels like there's a lot of intersections there and a lot of places for good work and more resources, but also really the private bar becoming engaged in a different way.
Yeah, so I'm happy to talk about that. I really do think you touched on a few really important points. Number one, there aren't enough private lawyers doing this kind of work. And how do we not only build more robust referral networks, but how do we incentivize more private lawyers to enter this space? As far as pro bono work goes, I don't think with a lot of these cases, pro bono is necessarily appropriate, where, there may be assets to recover from a defendant, or there are shifting attorney's fees for financial abuse cases. And so, every hour the private lawyer works, they can actually bill to the other side. And so it's a question of finding that, number one, bringing in more attorneys into this space, and then finding the right attorneys to handle it, where, I think, like, for example, the cases that I handle are mostly predatory lending and hard money lending cases. And I am not a pro bono attorney, but, generally I'm able to eliminate the loan and get my client their house free and clear. I don't know if that helps or makes sense. Yeah, so really complicated. There's so many things here that are that need work, that it's just it's a tough issue.
Yeah, no, this is it's such an important conversation. If it were simple to fix, it would have been fixed. And I think that it's by bringing in these different perspectives that we'll be able to kind of pull out some nuggets of potential opportunities. So really, really helpful input. And I'm so happy too that we've been joined by Andrea Higgins, who's also in our APS work group. Andrea, if you could introduce yourself, and we are happy to hear your comments and questions.
Thanks so much, Sarah. And I just my name is Andrea Higgins. I am an elder independent adult abuse investigator with the San Mateo County District Attorney's Office in Redwood City. And I really just wanted to share my great appreciation for this committee and the work that you folks are doing. I, on probably a weekly basis, if not more often, am working with our APS social workers, deputy public guardians, the prosecutors in my office, to try to bring legal services to older independent adults and their families when we can't fill the gap for them, whether it's an elder abuse restraining order, whether it is somebody trying to figure out their probate issues, whether it's someone who needs to put together a family trust or rebuild a family trust because they have been taken advantage of. And we are so challenged because the families and the situations that are most in need are the folks who had probably the least amount of resources to begin with, and who are typically, maybe coming from traditionally underserved communities. And all of the folks that they reach out to say, could you please help me try to recover some of these resources? And the folks that they reach out to say, we're sorry, but either we can't, or it's not in our wheelhouse, or there's not enough money that we could recover to make this viable for us. And it is so challenging because I don't have the right tools for that. So I am so grateful that you folks are doing this work, and for all of the, just wanted to share my appreciation for that, because this really has, all the work we're doing on this council has the ability to really improve outcomes for folks. But I feel like this has such an important role to play. So thank you folks so much for all the work that you're doing.
Oh, thank you so much, Andrea, for that really important perspective. And again, showing, how striking it is that the people who need the services the most are the ones who often are the ones who can't afford it. So we don't have access, and we need to figure out how to address these issues. So wonderful. We've been joined by Tony Anderson. Tony, welcome. Introduce yourself, and glad to have you here.
Good afternoon. Tony Anderson, Executive Director of Valley Mountain Regional Center. And I did just want to say thank you to the committee and the SIL in particular, because you gave me some good ideas some time ago. We have a situation where we have about 17 victims of financial crime. And at first I was a little discouraged because you guys also said it's very unlikely that I'll get any help. And but everywhere I went, I was getting the same kind of response, that it was unlikely, but that there were some things I could do. And so we did start working with the reaching out to the bar in our area, and but also let the district attorney's office know we were doing that, and just doing everything we could to push. And then a lot of you I talked to on the side, and you gave me other very helpful tips and things I could do. And it was very discouraging still, because we figured everybody also said that it's very unlikely, given that it was small, like $500 to $1,000 per person, that it was unlikely that we would get any justice for all of these victims. But I am happy to report that we kept on it, and we just heard that they will all receive, well, they're all scheduled to receive restitution from the person, and the person was convicted, and they went through on the court case. So I was just very grateful to all of you that helped me, and also opened my eyes to that this was not as simple as I thought it was, but it was a good ending. I just wanted to share that with you, and you probably would have had no idea that you helped us in this situation, but it was at least some moral support, and then also that maybe we could do something about this. So I appreciate that to everyone on the committee.
Well, that's fantastic to hear, Tony. That's something that I think we can consider a win just by bringing this group together. I don't know, Sil or Vivian, if you have any responses to that, any comments, but just glad, Tony, that it could be assistance in that space. There's too many stories like this, and we need to continue to figure out ways to address the system issues that lead to them. So thank you all. Wow, what a robust conversation. It's clear to me that Ranjana, as the staff and facilitator of this work group, you have a lot of great work ahead of you and of this group, and just can't thank you enough, Vivian and Sil, and to all of those who provided comment, our state partners, for a great discussion. And it actually, I think, is a perfect segue into our next discussion with the APS work group. But before that, and as long as there's no other comments from our committee members, I'm happy to turn it over to Megan and our communications team for public comment before we move to our next work group.
Great. Hi, everybody. Megan here. I'm not actually seeing any hands raised at this time, so we'll just go through the functions here. That the time's reserved for 2 minutes for public comment. You can raise your hand at the bottom of your Zoom screen. If you're on the phone, simply press *9 so that we can see that your phone line hand is raised. But yeah, right now I'm not seeing anyone with their hands raised unless it comes up in the next few seconds, Sarah.
I'll give it a second here, just see if anybody, any other comments or questions.
Sarah, I just want to thank all the panelists, the committee members, and Vivian and Sil for their wonderful presentation. And it goes to show us that we have a lot of work ahead for legal services, and all of the intersections that I'm seeing in the various work groups. We have to connect the dots. So thank you.
Perfect. I love it. And I think that it's going to be a tremendous resource having this project with the National Center on Elder Law and Rights / Justice and Aging, I think can really help think through a lot of the issues that have been identified. And with that, thinking about where are some of the best practices that we might see across other states as well. So that's just something to think about. So thank you for that really engaged discussion. Given that there were no other public comments, I think it's a great time to turn it over to our Adult Protective Services work group. And Ranjana, is there anything that you would like to say, or do you want me to just turn it over to Achilles?
No, Achilles, I don't have anything additional to say. Perhaps after Achilles gives this presentation. So yeah, let's just.
Perfect. Well, it's my pleasure to introduce Achilles Saron, who is the APS Program Director for San Francisco Human Services Agency. And Achilles and Andrea together have been, starting last year, they really led the work of what we had called I think we called it like a gap analysis, but it's kind of morphed into this new effort for us to kind of understand the intersectionality and what the challenges in the system look like at a kind of more local level, and how we see a lot of the challenges that have been raised in both the conservatorship work group and the legal services work group play over in the APS area as well. So with that, I'm so happy to turn it over to you, Achilles and Andrea.
Yeah, thank you very much. Again, my name is Achilles Saron, Adult Protective Services Program Director for the City and County of San Francisco. And my colleague, Andrea Higgins, I think she introduced herself. Do you want to introduce yourself again, Andrea?
Sure. Again, oh gosh, start my video. Sorry about that. Minor technical glitch on my end. Again, my name is Andrea Higgins, and I am an elder abuse investigator with the San Mateo County District Attorney's Office, which is, basically just a fancy way of saying I'm a detective who works for the DA's office rather than for one of our local police agencies.
So next slide. Yeah, thank you. So last year, as you mentioned, we were asked to look into the gaps, and Andrea being law enforcement and me as a public social service, public servant with adult protective services and our collective experience, we began to think, well, how could we identify? We know there are gaps, but how do we begin? It's just, so much to really think through. Some cases that we work together, APS and law enforcement, work out great, and many others don't. So what is the reason? So we decided to focus on 3 common scenarios that we believe exemplify many of the cases that we received. And we began to think, okay, well, if we look at the history or the life of the APS case, the APS referral, what happens? So in thinking about the Elder and Dependent Adult Abuse Civil Protection Act, which really gives the guidelines, and it is the mandate for receiving and responding to reports of suspected elder and dependent adult abuse in California. And it identifies 3 primary agencies, which is local law enforcement, adult protective services, the long-term care ombudsman. And it also has the requirement of cross-reporting these reports to appropriate entities, other entities, such as licensing entities, licensing of maybe, nurses or CNAs or a facility. And there are also other types of reports containing financial abuse allegations, but not by a fiduciary, but it could be a scam, it could be a construction scam, you name it. It's quite broad. So we receive a large volume of reports, and more often than not, it is difficult to track where some of those reports would go or should go. So that's when we started thinking, okay, what happens in a scenario, for instance, of financial exploitation or physical abuse in a facility or self-neglect in the community, and the various types of abuse that come with every report. And are these reports are they being cross-reported to other agencies? One example is in a skilled nursing facility, for example, long-term care, a report is made to the ombudsman, for example, and if the ombudsman cannot go and cross-report to the police, would the reporting party need to then go and call the police? And if they go, would the police say, well, have you spoken with the ombudsman? Or if the report is made to APS and then APS, because it was referred by the police and then APS will call the ombudsman. And so nothing can be simple, as some of you mentioned, and without, it is so challenging and difficult to comply with all the cross-reporting and receiving of these reports in the state. So, and not receiving these reports and the appropriate agencies does not promote coordination and doesn't promote timely interventions and well-coordinated effective interventions. So next slide, please. So, or gap analysis, which is still what we're proposing, and I'm sure that through these efforts, it will grow into whatever is most helpful. We believe that it would be helpful if these reports came to a well-trained, well-funded APS agency that is able to screen and properly cross-report and timely bring in those other entities that need to be involved. And also, by virtue of this ability to generate the data that other agencies that are also identified as needing to receive these reports to get a better picture of what truly is being reported in their jurisdictions, in their communities. So receiving the report is one thing, responding to the reports is the other thing. So how do we create timely interventions, but not only timely, but also effective interventions that address the abuse? After all, when these reports are made, the main idea is intervention, even though there may be prosecution at the end or the possibility of restitution or any other social service remedy that may be appropriate. You want to minimize the impact of the harmful situation where there is abuse, neglect, self-neglect, exploitation. You want to reduce its effects to preserve most of the person's functional ability, decision-making ability, and their property, their real and personal property. Once that is gone, a lot is affected by it. Lack of affordable amenities, resources, aging in place, you name it. So those are our recommendations. Next slide. So some of you mentioned the concept of no wrong door, one door, and what we're thinking it would be helpful when it comes to receiving and responding to reports of suspected abuse of older adults and adults with disabilities, and the numerous types of reports and settings, that these be made to one entity, to APS, for example, and a properly staffed and trained agency would be able to make the appropriate cross reports, and all these other agencies in code that would receive a report would know who else has received a report, and it could facilitate not only the data, but also the coordination, and eventually we think that would be of most value. Next slide, please. And it would also, through this coordination of efforts, like the Ombudsman, for example, and APS, we are really advocates. We advocate for access to services, to resources, and that these other mechanisms come in place to actually respond and help remedy the harmful situation and to develop a mechanism that will protect that older adult, the adult with disability on an ongoing basis so that the safety continues on. And we believe that the multidisciplinary teams that need to exist need to focus on intervention, but also the interagency collaboration amongst the agencies need to be more standardized with agreements. So it is really a community problem. It is not only APS problem or the Ombudsman problem or the police problem, but a community problem when it comes to intervention, where there can be these discussions, dialogues, learning. We've learned a lot through this experience today, and many of you were talking about legal aid, for example, and services. And we were proposing, having legal aid, for instance, be part of these interagency collaborations and coordination of services to develop these, to design ways forward for timely interventions. And for the law enforcement side, to also take a look at that aspect. And Andrea, do you want to talk a little bit more about post?
Absolutely. So one of the gaps that we really identified across all of the various scenarios that we looked at during our gap analysis is that folks in my law enforcement community have really a lack of training and support in understanding and effectively responding to elder independent adult abuse. And that starts way back in the police academy. I just went and looked at the current materials that are a part of post training when officers go through the basic police academy at the beginning of their careers. And there are 4 pages of information and training in the law enforcement curriculum in the academy related specifically to elder independent adult abuse, as opposed to approximately 146 pages related to domestic violence. So that just gives you a little perspective that, you know, we're really not providing law enforcement officers with the skills and tools that they need to understand and respond effectively to these kinds of situations, not just crimes, but situations, because the other piece is law enforcement needs to understand its role in the larger justice community when it comes to older independent adults, that we have an opportunity to be eyes and ears into situations and to improve outcomes, whether that means that there's a criminal justice proceeding or not. Ultimately, our focus should be on how do we help and support folks who are coming to the attention of law enforcement. So really better training in the academy and also best practices for ongoing support and training for law enforcement, I think will really support this concept of, you know, one door, no wrong door, and making sure that we have law enforcement folks who are equipped to respond appropriately.
Next slide, please. Another aspect that we were looking at, because of the nature of reports that we receive as the primary doors of receiving and responding to these reports, often these involve people who have been either unable or incapable of accessing systems. They might be isolated, alone, without the appropriate support system. And they find themselves in harm's way. We're talking about substantial harm's way. These are endangered adults or their properties at substantial risk, where often the most immediate intervention could be through a temporary conservatorship, for example. Whether it becomes permanent or not, that may be a different story. But to protect the person, to protect the estate, while an alternative is designed to assist individuals before they lose what they have, before they lose their ability to remain independently and to have that autonomy. It is important that we believe that probate courts are educated, trained in understanding these aspects of probate, not necessarily exclusive to estates, but we're talking about the immediate need of a surrogate decision maker absent a pre-existing appropriate way of supporting someone with those decisions. We're talking about people who are at substantial risk of permanent injury or death, losing their property, and we need to have some way of assisting individuals in a timely manner. And this would also help create consistency throughout the state. When Andrew and I were talking, we were thinking, we're making every effort to think beyond San Francisco or San Mateo, but the entire state and thinking what could help promote a fabric that would benefit every Californian in this situation, doesn't matter where they reside in the state of California. And this also requires funds. It requires budget for training, for this ability to receive these reports and triage them, but also to capacitate APS as social service advocates and coordinators of resources and entities through multidisciplinary teams to be able to exercise this advocacy and to, when appropriate, work and partner with our public guardians offices across the state so that we can discuss interventions that are appropriate and minimize any role confusion wherever there might be one. Also, in terms of restraining orders, some of you or someone mentioned restraining orders, and in discussing this, think of a police officer that maybe comes to the scene and issues an emergency protective order against severe neglect or physical abuse, you name it. That emergency protective order is as good as 5 to 7 days, and without the next steps, without a temporary restraining order and a formal restraining order, we are just, it's not a meaningful intervention that can really allow enough time to assist the older adult, the adult with disability, to really produce or to help us build this mechanism of protection. And these restraining orders, need to be in place. How do we partner with the civil remedies, with other legal services to help APS programs? And also on the criminal side, Andrea, do you have any comments on these type of orders?
Absolutely. I think this is really another opportunity for collaboration where, contacting the DA's office, finding out, are there criminal charges pending? Was there a restraining order put in place by the prosecutor? If the case has been filed, if the case hasn't been filed, is the prosecutor aware of the fact that there may need to be a protective order? Is the suspected abuser in custody? Will the victim be notified if that person is released from custody on their own recognizance? So, there's a whole component of that collaboration related to restraining orders, but also just providing support through the folks who are clients from the social services side and victims on the criminal justice side, to know that those restraining orders are only as powerful as a person's willingness to use them. So really empowering folks to seek those orders, to understand the complexities of these cases when violence is being minimized by the folks who have experienced it. Unfortunately, we see that an awful lot in these kinds of cases, and really just collaborating with the law enforcement entities to make sure that we're bringing that protective network as tightly around our clients and victims as we can.
And this highlights the importance on the advocate side, like in the case of adult protective services, is there a safe haven and an emergency shelter or a way to help protect the person when they are afraid and they would likely, if left alone, be unable to enforce a restraining order? Who is part of the support system that can be a gatekeeper to support these mechanisms? Next slide. And because of this line of thinking, I think that we need to explore what mechanisms are currently in existence in the state of California that really promote the timely intervention of endangered adults to really help minimize any impact of abuse, neglect, self-neglect, or exploitation, and really preserve their estate, preserve their person, their autonomy, and timeliness, which can only come through the appropriate coordination with other systems. It is paramount. And we believe that that's where the most of the value comes in, the fabric, and building the fabric to help our older adults, adults with disabilities who are in substantial harm's way, how quickly we respond, how well we respond, how coordinated we are in this response for it to be effective. Andrew, any final thoughts on that?
Absolutely. And I think on that second, the timely interventions to protect real and personal property. And we've talked about this kind of, again, across all three of our areas of focus, that for a particular, our older adults, if they lose their life savings, if they lose the home where they wanted to age in place, then we have failed as a community in our efforts to support them if we had an opportunity to do so. The mechanisms that we have in place currently to try to freeze assets in cases where it comes to our attention, either on the law enforcement side, on the social services side, those resources are really limited, and they are very arcane, I guess is the best way for me to describe it. For example, the probate code 2952 process is very obscure. It is typically led by law enforcement officers, but no one in law enforcement knows how to utilize this process. So we need better tools for protecting older adults and dependent adults' resources in the moment before all those assets have gone out the door. Because once they're gone, whether it's to a scammer or whether it's to a family member, those resources, even if we file a criminal case, it will take years, most likely, to even consider the possibility of restitution. And by the time restitution is ordered, there may not be anything to recoup from the abuser. So really, we have the ability to have a much better outcome for our older independent adult folks who have been victimized financially, if we can enhance some of those interventions for asset freezing, again, in a timely way.
Thank you. And that concludes our presentation.
Wow, what an amazing, what summary of these cross-sectional issues. I think it really summarizes a lot of the discussion on both the conservatorship and the legal services work group. And Blanca, I see your hand raised. Before we do that, I would be remiss if I didn't first turn to Jim Treghieri, who is really the lead on, helping facilitate and think through this work group in partnership with Ranjana. So Jim, would welcome some framing comments from you.
Yeah, thanks so much, Sarah. Really excited. Huge thank you again to Achilles and Andrea for the presentation. I think, it should be really obvious at this point how aligned, the work groups are in a lot of this thinking. And the exciting part is that really happened organically. And so I think when you hear these presentations, you see the through lines, you see that we're heading towards a more collaborative space. And I think that's really the power of EDJCC and this type of convening. As Sarah mentioned, I would be remiss in saying I am also a former legal aid. I feel like this is like an admission now. Former legal aid and a social worker. And really excited. I'm new to the state, so I've only been around for a couple months, but I really think the framing that I bring to the role that I hope is a strength is really that sense of collaboration. As Sil mentioned, as Vivian mentioned, as many others on this call have mentioned, it really takes a community to support older adults that need this type of help. And that requires of us at a lot of levels and at our individual roles and departments to really reach out across and understand what we're doing across departments, to understand how we can leverage each other's expertise and resources to produce the best results. I mean, there's so many exciting opportunities in front of us. One example I would share that APS is currently working on is, I know, initiative 68 of the Master Plan on Aging is around training for adult protective services social workers in understanding and assessing decision-making abilities. And so for our response for our program, what that has meant is implementing the Cornell Penn interviewing for decisional abilities workshop and training that we're going to be offering to APS social workers around the state. And what that really focuses on is kind of assessing functional limitations, functional where an older adult needs the functional supports. And so is moving into a framework where our APS social workers have the ability, the authority, and the skills to make the assessments that are going to be practically useful in supporting older adults moving forward and creating, like we've been talking about, identifying and creating those support structures that may support them long-term and may avoid the need for other interventions like a probate conservatorship as we talked about. So I feel like in stepping into this role, I got the cheat sheet with Achilles and all the good thinking around this work. So that's just a preview of some of the work we're doing in our work group. And I think, we're so excited to see what the other work groups are doing and to bring APS into this conversation in a way that is collaborative and meaningful.
Wonderful. Thank you so much for that, Jim, and for just the tremendous background and leadership you bring to this position. So, Blanca.
Yeah, I just wanted, first of all, it was an excellent presentation and wanted just to share with everyone that Senator Dodd introduced a bill this year. It's SB 278. I'll put that in the chat. It deals specifically with financial abuse, and it's also looking at holding others accountable if they knew that there was somebody who was being taken advantage of, and that includes banking employees. So I'm sure it's going to get a lot of attention, but I just learned about that today. I've not read the whole bill or done an analysis, just an FYI.
Great, thank you for that update, Blanca, appreciate it. So we have Vivian up next. Vivian.
Thank you, and that was a really great presentation. I really appreciate it. I did want to bring up, I think, whenever I'm talking about APS at a local or even national level, it's important to think about the equity issues with APS and its connections with law enforcement. I know that, APS has connections with law enforcement, utilizes them in different ways, but we also know that that connection prevents a lot of people from accessing APS services in any way because they fear negative outcomes from law enforcement for themselves, for their family members who may be potential abusers, and a lot of potential abuse victims even look at the sustaining abuse is a better option than the possible outcomes with law enforcement with their accused abuser. And that's a really big problem that we face, because that means that we know there are people who are not accessing services that are available to them, who need help, who are victims, and it's on us, it's on us in the system, that it's our fault that they are not doing that, because they don't trust us for very legitimate reasons. We have serious issues of racial discrimination and bias throughout our history, and we can't run away from that. So I think it's really important that in any kind of reforms or programs that we're implementing regarding with APS is that we really take a very serious look at any connections with law enforcement that are created, and we make sure that there is a distinct separation so that we can ensure that people are not discouraged from accessing services because of the connection with law enforcement. And in addition to that, I know that, there was a little bit of discussion about, training for law enforcement, things like that. I think there is room to look a little bit deeper about training with law enforcement, what that means, and is that even necessary? We do know there have been studies done that show that training for law enforcement regarding implicit bias does not work. It does not improve outcomes. So does that mean that we give more money to law enforcement that already takes up significant portions of our budgets? Or does that mean that we turn to the people who are already adequately trained to provide culturally competent, trauma-informed services, and we give them more money and we get them in the place to provide an alternative to law enforcement, which it's kind of hard to even say alternative to law enforcement because there really aren't any other alternatives right now for a lot of cases. So I lean towards, really funding the experts and the people who are on the ground already doing great work in elder justice and for people living with disabilities, and properly funding them and giving them the support that they need so that they can help and provide that alternative.
Thank you so much for that really important perspective, Vivian. A lot of important considerations in terms of how, the community may or may not utilize law enforcement to address these issues. So appreciate that very much. Howard. Howard, can you unmute? I think
Okay,
I see. Oh,
I'm
there we go.
unmuted.
Okay.
Okay, yeah, thank you. I do have one question. I noticed that one of the recommendations in the committee member and comment, one of the recommendations was that the probate court be funded to increase more temporary conservatorships of people. And my question is just how temporary would the conservatorship be? And what would be employed to keep that quote temporary unquote conservatorship from becoming permanent?
Okay, so thank you for that question, Howard. Your question was how we're really defining temporary conservatorship. If I'm hearing you correctly, I don't know if any committee members want to provide responses in terms of the recommendations that have been made. It's something that we can certainly note and I think perhaps identify as an area for discussion in the work groups, if that works.
Yeah, I think I would make a really quick comment that I think I would expand on that recommendation, and that what we're looking at really fits in with the recommendations that the other work groups have talked about, in that we're looking at measures that are really filling the gap between adult protective services and the public guardian, in that there are a lot of cases that start investigation where getting that intermediate support in place can take a long time and can leave an older adult at significant risk. So it's looking at all of the tools, temporary conservatorship certainly might be one, but I would expand that to say looking at all of the tools that are available to support people in a very vulnerable space that can last for an extended period of time while the appropriate measures get put in place.
Great. Thank you so much, Jim, for jumping in on that. And I'm so pleased, Nestor Lopez. Nestor, if you could introduce yourself, we're so glad to have you here.
Hi there, Nestor Lopez with CWDA. So I am the Deputy Director for Aging, Disability, and Older Adult Services with CWDA. Just started in November of this past year. Really excited to be working with you all. It's a pleasure to be here. Diane already dropped this in our chat, but I wanted to let folks know that CWDA is sponsoring a bill this year, AB 386, with Assemblymember Nguyen, to improve APS access to financial information from financial institutions to help protect assets in financial abuse cases. So Diana did drop the link into the chat, so please feel free to take a look at it, and we'd be more than happy to send you a fact sheet. So that was my big shout out from CWDA for today's meeting. Thank you.
Thank you so much for that update, Nestor. Appreciate it. Sil.
Hi, yeah. I also heard somebody mention the Senator Dodd bill, and I just thought I'd put a plug for that because I know that was introduced by CAOC, and it clarifies the application of the Financial Abuse Act to essentially say that somebody who assists financial abuse can be held liable if they should know that they are helping somebody take the property of an elder and that it's going to be harmful to the elder. There was a case from maybe 10 years ago, which said that somebody can only be held liable if they have actual knowledge of the scam. And so this is clarifying that if somebody should know that they're helping a scammer, they can be held liable. And so this is going to help a lot of seniors hold institutions and other people liable for financial abuse if they're engaging in conduct that's harmful to the senior. So I think people should look into that and express their support.
Terrific. Thank you for that very much. And Lisa.
Yeah, I just wanted to make the observation, and I think I made it in the work group, that it's really impossible to talk about adult protective services in isolation without talking about reporting or reporting laws. And, I think that it gets to Vivian's point too about the ways the laws work now, where every case is supposed to be cross-reported to law enforcement. I think those are things that need to be relooked at. So I would hope that the APS group broadens its perspective a little bit to look at reporting. And as Sil pointed out, there are a lot of, there's a lack of clarity in some of the reporting laws. And so just, adding to all the natural confusion that comes with all these entities that work together, the language of the law makes it even harder to kind of figure out what should be happening. I also really welcome the opportunity to think about the idea of kind of one-stop shopping or a centralized point of entry, because even with the pretty complicated chart that you had, Achilles, there's still so many more entities. If abuse is by a private professional conservator, that's another area that that potentially could be a resource or a remedy. Professional associations have their ways of dealing with ethical or professional conduct. So I'm looking forward to that. And thank you for a great presentation.
Absolutely. I also wanted to note, I believe we've been joined by Lee Bills with Cal OES, who's going to give an update on their RFP for elder abuse programs. Lee, are you?
Here.
Oh, there you are. Perfect. Thank you.
Oh, sorry, my video is not starting for whatever reason.
Oh, there you are.
Can I have the ability to share the screen? Because I would like just to have a few slides, no more than 5 minutes. I know it's the end of the day, but I would open. I think I just got the ability. Okay, let me share my screen, and I promise I will be swift. Are you all able to see?
Yep.
My screen. All right. I just wanted to really quickly give an update on our elder abuse program. I'm from the Victim Services branch at Cal OES, and we are a fiduciary agent. Essentially, we give money to programs that support services for victims of crime. So we're kind of a niche, and then a lot of what you've talked about is well beyond our scope, but we do have a little kind of piece or partner in this work. And the main program that I think I was asked to speak about today is our elder abuse program. And it is going competitive this year. So it's perfect timing. And I really am so pleased to be able to come and talk about it and hopefully get some outreach, because the program is going competitive. Our solicitation will come out sometime in June for a January 1 start. It's about $200,000 a year for a 5-year commitment. So when we fund a project, we fund it annually with a non-competitive reapplication for 4 additional years. And the purpose really is to provide as holistic as possible response to elder independent adult victims of crime. Right now we have 24 projects, and I believe about 10, maybe 9 or 10 are DA based. 7 are nonprofits, culturally specific nonprofits. 5 or 6 are in county social service agencies. I think we have 1 ombudsman, I believe. So this is a really unique opportunity. Folks can use the funds for any kind of response to the needs of victims of crime. It is not for prosecution and investigation. It is with our Victims of Crime Act funding that doesn't allow for prosecution or investigation, but it is for a lot of what you've talked about, those services that to kind of hold it all together, case management, any kind of service that is improving the safety, improving the well-being, improving the resiliency of the elder. So that's our an exciting opportunity that's coming up this June. Like I said, once you're selected for funding, we do commit to 5 years of funding, a little under $200,000 a year for the 5 years. So a little bit, almost $1 million over a period of time. Another opportunity that's coming up is our innovative response to marginalized victims, which of course elder abuse falls into. Currently, none of our 41 recipients have chosen to focus on elder abuse. Again, the main reason why I'm so excited to be talking to all of you, because we really don't get a lot of applications for this very marginalized, very vulnerable population, elders, independent adults. And so this program is really wide open. You can do anything. Again, it's the same fund source, so you cannot do prosecution or investigation, but you can provide, it's really wide. You can do just about anything else you might do to restore a measure of safety and security. This funding solicitation will also come out in June. The other program I wanted to talk about is our legal assistance program. And, we really had hoped, and of course, the legal assistance program is open to all victims of crime, which means elderly as well. But we're really hoping that folks would choose to specialize, because I think I heard a lot today when folks were talking. It's, that's great, you're a lawyer, but you still need to know a lot more about the services and different roads that the elders can go down to really provide holistic services. So this is another area where we anticipate a funding opportunity coming out very soon in March, and it can be used to focus solely on elders if the agency chooses. Right now we have all over the state, and they do focus on serving all victims of crime, both criminal and civil. And then the other component of this program, which is really useful for a lot of elder folks, is that we are really pushing for mobile legal services. So tele and video capabilities where people can not have to drive to go see an attorney, but interact with them in a different way. Let's see what's next here. Oh, 3 other programs that I usually highlight when I talk to groups that work specifically with an underserved or marginalized population. Our underserved and unserved advocacy and outreach program that just went competitive, so it won't go competitive again until June 2022. But I believe we do have 6 or 7 agencies that are focusing solely on elder abuse and looking at how can we impact the lives of elder abuse victims exclusively. So that's exciting. KE, this program was designed with APS in mind. We don't have any, I don't think we have any APS subrecipients at this time, but the idea here is that there are groups of people who may need emergency housing, but may also need special assistance, that they're not going to go to a traditional shelter or a traditional transitional housing program, that they may want to be in a location and need caregiving. Same thing when we talk about our commercially sexually exploited youth, where they're not necessarily able to function without some kind of assistance in a living environment. So that program will go competitive in March 2027, and then our transitional housing, which again, folks have the ability to choose a population if they wish, or they can serve all victims of crime. And these are the different, folks choose all kinds of different things. Unfortunately, what we see a lot is folks will pick, when we look at our underserved communities, they will pick a culturally specific community, or they will say Spanish speaking, but they won't often say elders, independent adults. So it's, part of it is our outreach. We're not reaching the right folks that are doing those works, but we're very interested in that. If you're interested in grants, some of the agencies that are doing this work that on this group might be, you can go to our website and hit search for grants, and that will take you to all of our solicitations. If you're interested in getting notified when we have a competitive funding opportunity, you can go here to the email notification and you will get on our listserv, and then you will be notified when we have a competitive opportunity for funding. We've been really good about committing to only putting competitive solicitations and our public meeting notices. Other than that, we don't send anything else out. So you're not going to get 100 emails from us if you sign up here. And lastly, I just wanted to point out that we fund a statewide resource list, which is great. It's the 1-800-VICTIMS list, and it's the most comprehensive list of resources for victims that I know of. And I've been working here at Cal OES in the Victim Services branch for 20 some years. And I don't know of any other, lots of folks have local resource lists that are very comprehensive, but this is the only statewide list that I'm aware of. And this is just an example of what you'd see if you were to search Alameda and elder abuse. This is the first of 2 pages of services that would come up. Sorry if you can hear my dog croaking in background. Pops. She's 14 and she's very sickly, but she likes to be here with me. Anyways, and then that's all I wanted to do. I don't want to take any more time, and I'll stop sharing, but I did want to give a little bit of information about how we connect to the work that all of you are doing.
Wonderful. Thank you so much, Lee. It's wonderful to know about these resources, and we'll be sure to send them out to our network partners as well. So important to take advantage of leveraging these sorts of opportunities. So wow, what a very rich discussion that we've had across all these three work groups. I want to make sure that, are there any other comments from committee members regarding the APS discussion or any others before we turn it over to public comment? Jim, any closing thoughts from you?
No, I just really appreciate Cal OES. In my former role was a grantee, and know that they're really wonderful to work with, and really encourage innovation, and for you to think, to think of new ways to serve older adults. So I would encourage you, if you're thinking about it, to check it out, because they really were a great partner in thinking about how to make for more robust services. In terms of the work group, you'll hear more from us soon, but for the time being, just really appreciate the feedback from others. Being new, I'm really in listening mode, and so a big portion of the work I'm doing right now is getting that feedback and hearing from different programs and different communities. So this isn't the only space in which you can reach me. Please feel free to reach out, email. I'd love to set up meetings to talk to you, to hear your concerns, and really want to make sure that we're listening moving forward.
Perfect. Thank you so much. I too feel like these committee meetings are a great time just to listen and learn and understand the issues. So before we open it up to public comment, I see that Carla Persinato has some comments. Would welcome your input, Carla.
I just thanks so much for everyone's incredibly valuable information and perspectives. Just as a follow-up, and again, coming from the clinician perspective, is as we think about all of our roles, it's amazing how many calls I get from colleagues, from residents in training, really fearful of reporting to APS. One, because of lack of understanding of the follow-up and what happens, and the fear of what will happen to the patient-clinician relationship, and sometimes bad outcomes to families. So just something to keep in mind as we move forward with this work group. And then the second point, which I put in the chat, is also the complexities that we're not trained as clinicians well on death certificates. And I've written some commentaries on this in medical journals, and the role of how do we actually document and actually really keep track of when deaths are implicated or potentially a cause of or due to elder abuse. So just some thoughts on future training needs. Since there's not enough work to do, might as well add to the list. So
yeah, it's really important to hear that clinician's perspective. So thank you for that, Carla, very much. All right. Well, again, thank you to Achilles and Andrea for leading that really important discussion, and to all of our presenters today. This has been fantastic. Want to also just appreciate the work of Ranjana, of Regina, and of Tanya Batista in preparing for this. And we will have some closing comments and next steps as well. But before that, we're going to open it up to public comment at this point.
Great. Hi, everybody. So just a reminder, it's another chance for public comment for 2 minutes. And you can either use your Zoom screen if you're joining us on Zoom, toggling at the bottom to raise your hand to ask a question. If you're on the phone, just pressing *9 on your dial pad, and then we will call you out in the order that we see you. And I'm just kind of glancing over here. I thought I saw some hands raised, but I do not anymore. Oh, one hand is now raised, 2 hands. Okay. Monica Miller, I'm going to unmute your line, and then you can unmute yourself as well and make your public comment.
Great. Thank you, everyone, so much for allowing me to provide public comment today. Monica Miller, Sacramento Advisors, representing an organization called Act 8, which is a consumer-driven organization intended to help consumers as they are transitioning their loved ones into RCFE facilities. We are looking to introduce a piece of legislation this year to hopefully codify some rules and some restrictions with regard to communication with family members once a loved one's been placed, and making sure that the consumers are in fact protected. We look forward to ongoing conversations. We've already had some great conversations with some folks on this committee. Look forward to continuing those conversations, and we'll reach out to others. But happy to be available for any questions should they arise at a later date. And thank you so much for your time.
Thank you, Monica. Up next, we have Maureen Sullivan. Maureen, I'll unmute your line and you can go ahead.
Hi, I am Maureen Sullivan and I'm with WEAVE. Many of you know WEAVE in Sacramento. We deal with all kinds of violence, domestic violence, intimate partner violence, and of course, elder abuse and dependent adult abuse. And I head up that area of elder abuse and dependent adult abuse, and just wanted to not even piggyback, but share with you that though we are county located and we're county specific, we have a multidisciplinary team that is sort of addressing all of the issues that have come up here, especially around the integrating the communication and sharing communication and gap analysis. Again, local, Sacramento County. We meet once a month, our multidisciplinary team, to work on this, and we're establishing gap analysis and resolutions or solutions to the gap analysis, and hope to have a report again addressing Sacramento County by the end of the fall. We're really, we've grown a lot in a year, and it's a very robust committee, and I'm enjoying moving this forward so much because it's so important, and I love sitting in on these meetings. Thank you so much.
Thank you, Maureen. I don't see any other hands raised at the moment, Sarah.
Terrific. Well, then with that, I will turn it over to Director Susan Morris.
Great. Sarah, thank you so much for facilitating such outstanding discussion today. I'm just awestruck by these three work groups and the way that the information and the material was presented today. So thank you all very much. I am, with so many former legal aid attorneys on, I'm not going to share a quote and not take attribution, but listening to the discussion today, I'm thinking of Dr. Maya Angelou and the quote, "When you know better, you do better." And today, my gosh, I learned a lot from all of you. And this is truly, this is the ideal of what a stakeholder council, the purpose that it serves to educate the administration, all of the departments and agencies that are represented on today's call, who either presented or joined in listen mode. What a terrific resource all of you are to us. And we will make good use of the information shared today. We will continue the work in the months between now and I believe our next meeting is June. I don't know if we have that on our, yes, June 20th. So we will not be idle between now and June 20th. As you heard from several people, legislation has been introduced that touches on a variety of these topics. All of that will be analyzed by the appropriate departments and agencies. Please, as stakeholders and advocates, keep us informed of your work. If you have budget proposals that you're carrying or you're supporting or opposing, and if you have legislation that you've introduced, please keep us informed so that we can follow that. A lot will happen in the budget and legislatively between now and June 20th. So it's really important that we continue to stay apprised of all of the work happening up and down the state. So thank you to all of our work groups, to Eric Dowdy, my co-chair, to the CDA staff and other departments and agencies who are with us. And I can't believe we had such a substantive meeting, and we might even be ending early. So that's just unheard of. Thank you all, and we will see you officially again on June 20th, but we'll visit with you many times between now and then. Thank you for an excellent meeting today.